Amen. It's a great day, and it's a Sunday, and you know Sunday is family time. When you meet and check on what has been going on through the week, what has been going on through the week. So, everyone that is here today will come. We want to check on what we have done through the week. Check on what we have done through the week, and also go through some few things. Also go through some few things like yes. We are talking about what happened through the week. So, welcome everyone to the platform. Benjamin the Wise Guy is the platform, and I'm Dr. Benjamin. Dr. Benjamin is a love of a good life that you are having that is good mentally and physically. So, let's talk about what you have been talking through the how to escape. Ashu Sony tells me how to escape. How do you, or you are playing a game? That is a game. I usually likes playing games on computer. So if you are coming in right now, welcome to the channel. The channel is called Benjamin the Wise Guy. Check if you have subscribed to the channel, and if you have subscribed to the channel, thank you so much. And everything that you as a person wishes to know about health matters, bring it. Let's discuss to this channel. Let's discuss to this channel. I like talking and interacting with my friends. Hit the like button as you come in. Hit the like button as you come in. And there are so many things you have done through the week. Don't just come and watch. Also, come and interact. This is an interactive session and platform. Come to my chat. Tell us where you are watching from. Tell us, I'm watching from India, I'm watching from the US, I'm watching from Africa, any country. And you know, when you interact, sessions become lively and we learn more. So it is a very good thing that you are in this platform. We want to go through what we did through the week. What we did through the week. There are several things that we did through the week, and they have really helped some people. They have really helped some people, and some of you even text me and say, continue doing what you are doing. Just a minute, friends. Yes, if you're coming in right now, don't forget to subscribe to this channel. Subscribe to the channel. what were we talking about this week? This week we have talked about several things. And one we have talked about is we have talked about drugs. Drugs can be a blessing to your life, can save your life. And the other thing is also drugs can be a curse. You can take some drugs and you become worse than how you are. So these drugs that we use in hospitals, we discussed about them through the week. We discussed about strong analgesics, long time use of codeine. We discussed so many things. Today we are going through things that we discussed through this week, and it is important we remind ourselves on what we did and what we talked about. You see, classes of antibiotics. You remember we talked about how antibiotics are given and the classes of antibiotics. We talked about penicillin classes, cephalosporin classes, sulfur drugs, sulfur antibiotics, why antibiotics are controlled medicine. We said why antibiotics are not supposed to be just over the counter. Correct use of medicine, therapeutic index. You remember what therapeutic index is? We talked about what therapeutic index is. Promethazine. Someone asked about promethazine, if it is H1 or H2 antagonist. So I said it is H2 antagonist. H1 antagonist is not an H2 antagonist. Diabetes mellitus, we discussed the prevention of diabetes, normal respiratory. We have done so many things through the week, and I'm welcoming everyone. If you are here watching for the first time, come to the chat and tell us where you're watching from, and subscribe also. It is a Sunday. You know, a Sunday is a family day where everyone is at home, feeling nice, preparing tomorrow to go to work, and schools are back. Schools are back, my friends. Schools are back. The schools are back. Children next week will be going back to school in Kenya, in my country. So I know preparations are undergoing. Every parent is preparing for back to school. Now, let's go through what we did through the week. But if you have any question, if you are watching, please don't leave without hitting the like button. Likes help things called impression. When you like it, it leaves an impression that I am doing a good thing. So hit the like button where you are, and don't forget, Benjamin the Wise Guy is here to make you feel home. So let's talk about these things. Let's talk about medical tips on what we have been going through the week. You know, on Sundays is a day that we rejuvenate ourselves, we remind ourselves, and we plan for next week. This is a day that if someone has something that wants us to talk through the week, you tell me so that we plan and then we do it. So who is watching and where are you watching from? Are you watching from America, US, India, African states? Tell us you're watching from these states, and let's continue interacting. My friends, everyone that are here, let's continue interacting. Let's continue supporting the channel by watching and sharing the videos. You know, watching and sharing these videos really help the channel to grow big. So let's talk about something that we discussed last week, strong analgesics. When I'm talking about analgesics, you know, I'm talking about painkillers. So we have strong analgesics, and strong analgesics used for moderate to severe pain. Examples are morphine. Dr. Ben, Jambo, Sha Travel got the shield. Sha, welcome. I can see you have the shield. I distributed shields, and yours is for the community. You are serving the community. Imagine. Sha Travels, big up every time. I can see you are serving the community. Big up every time. Thanks for tuning in, and thanks for that shield. When you come to my channel and you find that you have a shield, I've given you a shield and you are serving the community, just know you are a blessing to my life and to the people that you are serving. because now the money that is coming from you is serving some other people. It's serving some other people. So be blessed, everyone. Share travels included, and everyone that is coming to my channel. Now, strong analgesics like oxycodone, morphine, fentanyl, and tramadol. And tramadol. We discussed why they are prescription only. You remember why they are prescription only? Dependence. We talked about dependence, addiction, very many things, tolerance of these drugs at a high rate. We talked about it this week. Adverse effects and precautions of these drugs. We talked about them, and then we went to long-term use of codeine, dependence and tolerance, constipation, drowsiness and impaired concentration, respiratory depression, withdrawal symptoms, and risk of overdose. This we talked about codeine, and you know codeine is a derivative from cocaine. So that one we talked about it, and we are enlightened now. Everyone has enlightenment when it comes to these problems. Classes of antibiotics, my friend. I told you, you cannot just be given an antibiotic. When you go to a hospital, you go to a pharmacy and you tell them, I think I have a bacterial infection. They do a full blood count, full hemogram, and then they do culture and sensitivity and find there is a bacteria. All bacteria are treated differently. So there are several classes of antibiotics that we treat upon: penicillins, cephalosporins, macrolides, tetracyclines, aminoglycosides, fluoroquinolones, sulfonamides, and glycopeptides. We discussed their general use and examples. I gave an example of respiratory issues, aerobic bacteria and anaerobic bacteria. They are treated with different types of antibiotics. So we talked about them and you ingested, and now it is your time to do the good thing and not be going over the counter for antibiotics, my friend. Antibiotics, even if it is amoxicillin, even if it is macrolide, which is a zithromycin, don't go over the counter. Find a doctor, find a medical worker who can examine you and be given. Imagine something like penicillin, the classes: natural penicillin, aminopenicillins, and penicillin-resistant penicillinase resistant penicillins. We have anti-pseudomonal penicillins. Imagine they treat different things. Cephalosporin from first generation, second generation, ceftriaxone, which is a third generation, cefixime second, fourth generation, fifth generation. Each generation has a different antimicrobial coverage. We talked about them. So if you are always going to be given ceftriaxone, you know when you are sick, ceftriaxone will help you. That is the coverage that you are giving yourself to attain resistance. We talked about sulfonamide antibiotics, like which one? Cotrimoxazole. And I know someone will tell me cotrimoxazole is a big word. Cotrimoxazole is Septrin. The people have allergy of. Most people have allergy of sulfur don't take Septrin because it is a sulfonamide. The drug containing sulfur. Now I'm going through classes of antibiotics, and you are opening up your mind knowing that, these classes of antibiotics are dangerous when they are not prescribed, including amoxicillin, which is a penicillin. Why antibiotics are controlled? Why are these antibiotics controlled? We talked about them. Yes? If you have a question, my friends, this is a recap of the week, what we did through the week. Please give me your question. Let's talk about what you think. And if you are a new person to this channel, you know what to do. Hit the button, subscribe to the channel. Rhoda Shaki, hi Rhoda. How things have to be done. Sorry for that. I can see Rhoda Ivy Shaki. Rhoda Ivy Shaki. Big up yourself, Rhoda Ivy Shaki. You are the best. Hit the like button. Welcome to my channel. My channel is a good channel. It talks about good things. Good things like how to make things happen in a good way. Now, sometimes let me activate something here. Activate something. Now, antibiotics. Now, we talked about several things like why antibiotics are controlled medicine. You who is watching me, hit the like button. If you have not subscribed, please subscribe to the channel. Why are you not subscribing? Subscribe to this great channel, this channel of people, channel of imagine I'm advising you on how to live freely, feel free, feel good. Imagine, and you're not subscribed. Let me tell you one thing. I know you know why antibiotics are only prescription medicine. Please tell me, if you are watching me, please tell me why antibiotics are for prescription. I know you know, but you don't want to say because you go over the counter when you have a flu and ask for azithromycin. Why? Because you'll just take it 3 days, very short, and you think you are okay. Yeah, man. Why? What happened, Dr. Ben? Oh, some. Let me do this. Let me do this. Yes, so that people cannot call. Because some people always disrupt you when you are very serious talking to your favorite people like Sha Travels and Rhoda, Ivy. Everyone sometimes are confused. Now, we were talking about antibiotics are. We talked about it last week. Why antibiotics are controlled. This idea of going over the counter or taking a prescription that is fake for antibiotics, you are destroying yourself. Please go and watch that video. But we say it again. Let me just give this. Let me say this, my friend. Let me tell you this. Prevent antimicrobial resistance is one of the main leading cause of why antibiotics are controlled. Prevention of antibiotic resistance, one of the main cause. Yes, you, my guy, imagine I asked a question. If anti-TBs, you know TB, tuberculosis is treated by rifampicin, isoniazid, pyrazinamide, and ethambutol. 4 tablets that are antibiotics. Imagine a person getting resistance of those antibiotics and has TB. You get resistance of those 4 antibiotics. What else will you be treated with? So the main leading cause of why antibiotics should be prescribed medicine is because to prevent. So grateful. Happy Sunday, doctor. Happy, so grateful. I thank God you are here and we are learning. Happy Sunday. We are learning. Meet Sha Travels. And let's continue. The main leading cause of why antibiotics are controlled and prescribed medicine are prevent resistance, reduce inappropriate self-medication. Because your friend had the same medicine and your friend got better, you go over the counter. Ensure correct diagnosis by a qualified physician, a qualified health worker. Prevent unnecessary antibiotic use and promote completion of appropriate treatment. You know one thing. You know one thing. Have you ever asked yourself why some people that have TB, even if they feel healthy and they can do their job, they are retained in hospital? Have you ever asked yourself that question? Or some diseases, you feel that you are strong, you can do anything, but the doctor tells you cannot be discharged. Stay in hospital. Promotion of completion of treatment. Antibiotics is no one, man. It's not a joke. You get? Prescription medicine, we talked about them. We are doing a recap of the week. If you didn't understand anything through the week, my friends, bring it on. Let's talk about it, and let's talk about all these things. Medicines require authorization from appropriate qualified prescriber. Let me talk about it again. Medicine requires authorization from appropriate qualified prescriber. Discussion of different types and categories of medicine is very important. And I said they take, what is this? Oh. And I said there is a, okay, telling me my phone has been disconnected from, and I said one thing, there are several things, and we counted them. There are like 10 things that we check when we want to give a person a drug. Let's go through them again. Let's go through them. I want to give person A an antibiotic or a drug. 1, we check on milligrams. 2, we check on the diagnosis and the drug I'm giving. 3, we check on bioavailability of the drug. 4, we check on pharmacodynamism. 5, we check on pharmacokinetism. 6, we check on bioavailability. 7, we check on half-life. 8, we check on how the milligrams of the drugs that will be appropriate to work well with the person, not to attain resistance if it is an antibiotic. 9, we check on elimination, how it will be eliminated from your body. 10, we check on therapeutic index, dosage and toxicity. Therapeutic index, how many things are those? 10. But you, because you know some little Google, or your pharmacy friend knows, has trained you on something, or your friend who is a sweeper in the hospital for some time and has learned some drugs, or the cleaner has learned some drugs, because this cleaner always cleans the pharmacy, advises you, my friend, that is very bad. Please go for a qualified. You will not understand therapeutic index if you are not trained of drugs. Antibiotics, analgesics, antivirals, antifungals, all those drugs have different characteristics and they are different classes. Yes, that's why people go to school 7 years, and sometimes even some things you still need to go and learn. Yes, correct use of medicine. We talked about correct use of medicine. Yes, they have different side effects. Very true, travel. Take the correct medicine. Yeah, if you are suffering from a viral infection, don't take antibiotics. Use the correct dosage. It's very important. Follow the correct timing. If you know, there are some drugs that are taken 4 times a day, and there are some drugs that are taken twice a day. Timing, 8 hourly, 6 hourly. Those are those ones we give because of half-life, the amount of time that the drug in your body will be reduced to half the milligrams you have taken. Yes, and some side effects are equally lethal. True. Even the paracetamol that you take and feel it's just paracetamol, it will destroy your liver if you misuse it. You get. Complete the prescribed course where appropriate. Or if you don't want to complete, go and talk to your doctor first. Check the expiry date of the drug that you are being offered from the pharmacy. There are some pharmacies, they are so busy pharmacies. There are some pharmacies that are very busy, and some drugs have expired. It's not their problem, but the way they work, you find you have been given a drug that is expired. Yes, check the expiry date. Avoid sharing medicine. That one I still say. Avoid sharing because every medicine has got dosage. You get, store medicine correctly. If it is in a cool, dry place, if it is for refrigeration, and some people may say that I don't have a refrigerator. Go to the pharmacy, tell them, in my house I don't have a refrigerator. Please keep for me these drugs. Wherever time that I'm needed to take them, I'll be coming here. Don't tell us you don't have a refrigerator. Every pharmacy must have a refrigerator according to the rules of the government of every state, medical. All that are coming in and are new to the channel, please hit the like button and subscribe to this channel as we go on. We've said store medicine correctly, but there is this thing that people tend to ask me every time: therapeutic index. What is therapeutic index of a drug? Measure the safety margins of the medicine. Safety margins. You see, a high therapeutic index generally indicates a wider safety margin. You understand? Or I can say a drug that has 100% therapeutic index has low chances of killing you. But a drug that has low therapeutic index like 15%, you misuse it, my friend, it will hit you like never before. Hit you like a drum, and then you come to the hospital, we start doing dialysis because it has destroyed your kidney. You see? So if you are watching, I want you to check on one person here called, one person who is my sister, big sister, called Sha Travels. You can see she has a picture of a shield to the community. Ask Sha Travels, how did you get this picture here on your name? Ask her. Low therapeutic index means dosing require greater care because it can destroy your organs. Someone asked about promethazine and H2 antagonists. H2 antagonists are like ranitidine. Promethazine is H1. That is not. Promethazine is H1 antihistamine. So when you are having hives, you can use promethazine. The only problem with H1 antagonists, when you want to sleep, you take them. You take promethazine 50 milligrams. Hey, you can sleep, my friend. Say sleeping. Say sleeping. Yes. All antihistamines have the effects of dosing. And those are people that are in this channel that are want to use so so grateful is feeling nice. Those people that are in this channel, ladies, I know some ladies, young ladies, yes, they want to grow with a curvy figure, feeling that they look themselves on the mirror, they say, yes, God created me. And then you go to a rock pharmacy, tells you that, if you use C4 tablet, you will be very figured. Your backward will be so cool. The C4 tablet that you are using is a H1 antagonist, and it is called cyproheptadine. Cyproheptadine is an antihistamine. It makes you to have good appetite. Good appetite. Adverse effect of antihistamine. Good appetite and sleeping. Yes. So don't think that you are creating what God created. What you are doing is you are eating a lot, and then you are being, I don't want to use that name, because if I use it, some ladies will throw stones at me and say, doctor, now, oh. The doctor is just advising, and the doctor is advising, and when you're coming to Dr. Ben's channel, remember Dr. Ben loves everyone, including you who is watching. You see, you are watching me. Yes, you who is watching. Say something to the chat, but don't forget to tell us where you're watching from. We want to know where people are from. There are some people who come to the channel, to my channel, they ask questions, and then what happens is they delete all the questions. They are insecure. They think someone will know it's them. No, you don't do that. Hmm? So, we talked about diabetes mellitus. Diabetes. And people know when someone has diabetes is the sugar levels are high. How high? Ask yourself, how high are the sugar levels? Yes. So diabetes is not just how high the sugars are high. Your pancreas, there is an organ called the pancreas, which has cells that are called beta cells, producing something that is called insulin. So the beta cells producing insulin. Yeah? If these cells are destroyed partially, or if they are producing little insulin, that is when your sugars level go up, because there is no insulin to convert them into glucagon. No insulin to convert it into glucagon. And then what do? You start having problems, start becoming problematic. Intolerance, glaciated hemoglobin, low HB, oxygen, because all your HB are having glucose. You know, if your cells have a lot of glucose, you will not, in the red blood cells, you will not transport oxygen well. Diabetes involves persistently elevated blood sugar levels. Major types are type 1 and 2. Type 1 is when you are born with it and your cells are destroyed. You only use insulin. But type 2, most of them, it is lifestyle. You bring it to yourself. You bring it to yourself. And what do Chat Travel says? Interesting. Yes, it is interesting, right? You bring it to yourself, lifestyle. So now you at least know that diabetes is not just high sugar levels. I've started going to the pancreas, then inside the pancreas I've said there are cells called beta cells that produce insulin. And now people are born without the cells and they start using insulin since birth. That is type 1 diabetes. Type 2 diabetes, because you are eating good things, yes, carbonated drinks, wow, and then cholesterols are piling, and then you see my skin is looking supple. Yeah, it is looking very supple, my friend. Good. But what are you bringing to yourself? You are bringing insulin resistance. The more cholesterol, the more fat you are bringing. Doctor, actually, most people stumble on the disease accidentally without knowing. Yes, because of what you are doing to yourself. And then you start struggling. We talked about the signs and symptoms of diabetes. Remember, urination, thirsty, neuropathies, all those we talked about them. You are always taking water, going to the loo every time, headache, dizziness. Long-term uncontrolled diabetes can affect the eye, kidney, nerves, heart, and blood vessels because of glaciated cells, get neuropathies and organ damage. But you know what? You can prevent it. You can prevent getting there if you are not born with it. Why? Maintain a healthy weight. 90 centimeters of your waist below. Yes. Exercise regularly to increase insulin production. When you are exercising, insulin is produced and you feel nice. Reduce excess sugars. Yes, carbonated drinks, fructose, what you call only taking honey and not sucrose. Yes, because of what we are putting in our mouth and what we are eating is causing those problems. Yes, clap for Chat Travels. And so grateful too. I've said you can prevent it from happening. Maintain a healthy weight. Exercise regularly. and eat a balanced diet. Avoid excessive processed foods. Yes, most of them are carbohydrates. Smoking. How does smoking bring diabetes? My friends, I explained that. Yes, smoke has excess. Doctor, most of us do heavy farm work, but we don't lose weight. Yes, but you don't lose weight. There is one day, my mom said, "You guys, we were going to the gym, and we come when we are very tired. We have just been from the gym, and we are very tired. So my mom tells us, why can't you guys go home? You guys, you need to go home. You know where is home? Home is the villages. Do very manual work. Carry heavy sacks of grass for the cows. That is enough gym." Then we laughed at our mom. Working out and doing some things is different from the manual work you do. Some manual work that you do heavy might destroy you. People that carry a lot of things from the shamba, always digging, most of them have back problems. We don't intend to say that. But when you're going to work out on a gym and you are trained, you are working on your muscles to get lean muscle without cholesterol. So it is totally different. Reduce excess sugars. Take excess sugars, chocolates. Increase dietary fiber. Avoid excessive processed foods. Monitor blood pressure and cholesterol regularly to avoid insulin resistance. Limit excessive alcohol intake. Those people that take alcohol, limit. You'll get fatty livers. A lot of hydrocarbons with fatty livers are friends, are real friends. Check that out. Have appropriate screening if at any risk. Appropriate screening. Now, that is about diabetes. You can check the talks that we had on some previous talks that we had. You can check about them, and then you find out upon yourself where you lie. But we talked about respiratory rate. Normal adult respiratory rate is approximately 12 to 20 breaths per minute. The high abnormal is called tachypnea. The low is called bradypnea. There is something that is called specific gravity. Specific gravity, when you go and do urinalysis, maybe you are urinating and then you feel itchiness. So you go to they do urine analysis, they tell you your SG is high. It reflects the concentration of your urine. High specific gravity may occur with dehydration. Low specific gravity with excess fluid intake or impaired concentrating ability. You see, liver function test. What is liver function test? Liver function test is, it checks when you go to the hospital and they say we want to check liver function test. Liver function test is done because of several things, and these things are maybe you have fatty liver, maybe they are suspecting cancer, maybe they are suspecting toxicity. There are some enzymes like alanine transferase, aspartate transferase, alanine phosphate, all those. They check on those to see if they are normal levels, because when you have problems they vary. Then there is something called bilirubin. Bilirubin is destroyed. When your red blood cells in the liver are destroyed, maybe by intoxication, and then you see someone is urinating yellow, that is bilirubin, that is changed from biliverdin. When red blood cell is destroyed, it produces heme, iron, and a protein. So with those the heme part and the iron part produces something called biliverdin, which is yellow. So that is what is bilirubin, that you urinate. That's why people, when they are so intoxicated with alcohol, you see their urine is yellow. So it happens in the liver, and that is when even children, when they are born, and then a mother is told, you take your child to the sun, or they are put on an infrared thing. It is to reduce bilirubin, because when the child is born, several liver cells are damaged. So albumin reflects hepatic systemic function, especially over time. Albumin is a protein. Dr. Ben looked like he's about to fall asleep on us. Yes, because I've not slept yesterday. To now, I'll sleep today. I've been up here and there, up and down. Here and there, up and down. So you can see. Yes. Mental health and physical symptoms. That is what we discussed today. We discussed mental health problems can produce physical symptoms like headache, fatigue, muscle tension, chest discomfort, sleep problems, changes in appetite, trembling, shortness of breath. All these are problems that you can get. And this one we have done today. Please check it out on that video of today and see how mental health problems can bring physical deterioration. It is very important. Stress, anxiety, depression, all those. And we talked about something that is important: medication safety. Do not increase the dose because a medicine seems ineffective. You are taking medicine and it is ineffective. The symptoms are still coming out. Marjay, come on. Welcome to the chat. Dr. Ben and everyone, welcome. When you have been given a drug and then you are told, this drug you take 2 tablets, 1000 milligram in the morning, and then you say you take the second one you take 1000 milligram in the evening. When you are not feeling good or the symptom keeps on coming on, you don't increase from 1000, you add 500, it becomes 1500 in the morning. You can get toxicity. So it is important you go back to your doctor and tell your doctor, I can feel that my symptoms are not getting well. Please review me. That is called medication safety. Medication safety. Do not combine medicine without checking interaction. Interaction, that is the 11th part that we didn't say among the 10. Interaction, there are some medicine when you take them with others, they interact and then they don't become ineffective because they form some crystals or a precipitate. You know, in chemistry, for those that did chemistry one day, there are some things that we were mixing and then you see potassium has interacted with hydrogen and then they have formed a precipitate. That is what can happen to your bone. Formation of a precipitate which can be toxic or which can be non-toxic. So you don't do what? You don't mix drugs. Ask your doctor first. And if you go to a doctor and there's some medicine that you are taking, what you do is tell the doctor, I'm taking these supplements. Tell the doctor, I'm on this and this. See, avoid using someone else's prescription because it worked to that person better. You get me right? Avoid using someone else's prescription. Tell healthcare professionals about allergies that you have because you know yourself better than the doctor knows you. The doctor is just treating what you are explaining. I'm feeling this. Then a doctor gets his or her diagnosis and then the doctor treats you. You check me out. You feel me? Yes, you feel the doctor. Feel me, man. Feel me. Let's get the right usage of medication and safety in ourselves. You feel me? Seek medical attention for serious adverse effects. You may take sulfonamide, Bactotrin, Septrin, and then you get anaphylactic reaction. You will get respiratory depression and it may be fatal. So every time you feel now I've started, rush to a doctor. If you know I've taken this drug and I've started feeling the same way, so I don't want to feel, go to the doctor and report it to the doctor. And then we talked about several things that are very important when it comes to drug administration. I know you who is watching me somewhere, someone somewhere, you know, I know someone somewhere takes a capsule because this person wants to get well. Takes a capsule, removes the tip, and then takes what? Because you want to get well so fast. Hey, you will not get well so fast. Those capsules are coated with that gelatin capsule so that it goes to open in the stomach. Why? One thing is it may have some reagents may interact with the capsule, the drug around your mouth. It may be bitter, you may vomit, and that one will not help you. So, routes of administration of drugs. How do we administer drugs? Yes? Hey, if you are watching me and you are not smiling, what are you waiting? Smile a bit. Shat Travel tells us that Dr. Ben seems like he's gonna fall on us, sleep on us. Shat Travels, I haven't slept. I'll sleep today. The whole of yesterday, today. Even Uncle, we have talked. Uncle is preparing for birthday. Uncle is birthday boy right now. I don't know what will come on his life today in the evening. He was asking me, hey doctor, what is happening? Really, Uncle, I can't come on like that was yesterday. So, routes of drug administration. How do you give yourself drugs? Please make sure you get some rest today, Dr. Ben. Yes, I'll get some good rest. Very good rest. There are some drugs. Doctor, you didn't answer my question about fatty liver signs. Oh, fatty liver signs. Let me finish with oral route. It is administration. Then I answer yourself. Fatty liver signs. Fatty liver. You know, sometimes when you have fatty liver, you can get cirrhosis, liver cirrhosis. Very crucial thing. So let's finish with this. Then I answer so grateful, because so grateful is always so grateful to information that you give her, and we thank God for the kind heart that she has. So let's finish with this one. Oral drugs that you are supposed to take by your mouth. Sublingual drugs that you are putting are under tongue. Yes. Intravenous injection. Intramuscular injection, not in the vein but in your muscle. Subcutaneous, just around the skin where the fats are. Subcutaneous. Topical, you put them. You have rashes, you put a cream that is called topical. Inhalation, you inhale the drug. I can see some people eavesdropping. If you are eavesdropping, make sure you are subscribing. Eavesdrop to the channel, tell us where you're watching from, and subscribe to the channel too, my friends. Don't just come, you listen, and then you go. Hey, my other friend, TPKY Love is in the house. Guys, follow TPKY Love. She's a friend from India doing great work on her channel. Oh, TPK has got my shield. Look at the shield. I enjoyed your presentation and information regarding diabetes. It was a master class. Fly Aubrey. Yeah, man. Thank you so much for your compliment. I like Good compliments. Thank you so much. Today is so cute, doctor. Yeah, doctor sir. Good evening. Good evening. So TPK love is in the house. TPK, fly, my brother, fly. That Travis, now you're making me feel shy. Fly Aubrey, thank you so much. Hit the like button if you're coming in. Hit the like button and do what? And subscribe to the channel. I know all of you have subscribed to the channel. So if you have not, TPKY Love has got my shield. Just has started the journey to make Ben Hub to the greatest. And then you go to the journey where I hand you the shield. Take it. This is Ben Hub. You know, I'm working on very many things and supporting very many issues and things and humanity issues. So that shield that you see that TPK has and the one that Shad Travels is handing to the community, it has stages. You start by you getting the shield, then I give you the real shield after the second month. The third month, I trust you to one of my soldiers. Now serve the community. That's why you can see I mostly stay in the bush, but I appreciate the care and medical guidance you offer so freely. Thanks for that, man. Thanks. You see, people have started blessing me with some green tea. Thanks. Let me say thank you so much. Thank you so much. You so much. Yes, that is Fly Aubrey. Fly Aubrey, thank you so much for that. I will take some more green tea. Yes? Now, we were talking about the journey of Benham. Benjamin the Wise Guy is a channel that is facilitating the journey to Benham Medical Center. I call it Benham Cardiac Center. I want to own a cardiac center because of the aged guys have cardiac issues. And before I continue, I know I have to answer a question here. Let me say this. It is in Kenya, very expensive gadgets. Treatment for cardiac issues are very expensive. So the journey has just started. And that's why you can see TPK it's called Priya Sharma. Not Priya, it's called Priya with a shield. You can see Shah Travel handing over a shield to the community and blessing them. And then you will see someone with a shield of me giving him or her the shield. So stay tuned to this channel and you'll learn more things. So let's get I want green tea. I'm always having green tea when I am here talking. You know, I'm always having green tea because it is an antioxidant. It is. I will talk again about antioxidant. It is an antioxidant. Nice. Let me tell you one thing. Before I embark on I went to a wedding and I took wine, half a glass. Hey, I had to take green tea. Those people that take alcohol, hey, I don't know how you survive. Hey, I told my sister Shah Travels, so Dr. Ben, I'm important to this community. I see. Yes, can't you see Shah Travels? You are handing over the shield. Look at that thing that is on you. You are big baby, Dr. Ben. I drove my car 5 kilometers per hour, and when I went to the gate, the person who guards the gate told me, Doc, let me help you to park. I will never do that again. Alcohol and wine not my thing. So let me take my green tea and I be safe. So inhalation drugs that are given. You have seen asthmatic people when they are sick, they are given an inhaler that goes in and in. And there are some things that are called vaginal pessaries and suppositories. Suppositories are given annual. So don't take that tablet that is written vaginal pessary or suppository and swallow it. Your stomach will, hey. The right medicine, listen to this. The right medicine, right patient, right dose, right route, right time, appropriate monitoring is safe treatment. Let me repeat it again, my friends, and thank you so much for coming in and listening to this. Share this to people. The right medicine, let me start with right diagnosis, right medicine, right patient, right dosage, the right route, transdermal, oral, pessary, all of them, and right time, appropriate monitoring is safe medication, is safe treatment. You get that? Should I repeat it again? The right diagnosis, we start with impression, right impression from the doctor, right diagnosis from the lab and that are from the lab and imagings. You get a diagnosis from the doctor, right patient, right dose, right route of administration, right time, appropriate monitoring, and safe treatment. You are well, very okay. Yeah. Main, antibiotics. Antibiotics are prescription medicine, even if it is amoxicillin. Don't go to buy 2 amoxicillins in the shop. Pharmacology, diabetes. These people are having some problems that need right treatment. And I'm not today. You are not asking me so many questions. It is okay, but there is several things that we need to understand. But let me answer the question about the fatty liver. Let me answer the question about fatty liver. There are some common signs of when you are having a fatty liver that you may find. Before I answer that question, let me give you an overview of what the liver does. Anything you take in your body should be excreted after you have used the calories that you need, the amount that you need. So, if it is glucose, it is absorbed in the bloodstream. And it is absorbed to the bloodstream from your stomach, even if it is amino acids. They go to the liver. The liver is the major organ that detox. You cannot detox your body. I had my friend, and she said it. My friend is called Simplicate. She said, I want to detox my body. And then she laughed and said, I know Dr. Ben will be on my case. There is nothing you can do to detox yourself. You either treat or you either treat or avoid bad things. There is nothing like detoxing. The liver detoxes. So when it has absorbed the nutrients, they go to the liver. For you to excrete something from your body, it should be water soluble. Your body is made of proteins and cholesterol. So if something is protein soluble or cholesterol soluble, it will not come out of your body. It will be just surrounding your body. You see? So when it goes to the liver, it is changed from protein soluble to water soluble, so that it can get out of your body through the kidneys, through the portal circulation. Portal circulation is here around the abdomen, and then it goes to the liver. Portal circulation is blood circulation around the stomach, the liver. See, so when you have taken a lot of things that are destroying, the liver is doing a lot of work to detox, to change it from protein soluble or cholesterol soluble or something soluble to water soluble, breaking it down. You start having some fats because the liver cells, starts changing and depositing fats instead of removing. See, so you start feeling tired and fatigued because the liver itself, it is not working normally. It is not working normally. Some part is being filled by fat. Dull discomfort or pain in the upper right abdomen. The liver is here. So you'll feel the pain here, upper right abdomen here. You see, you just feel unwell. Something is wrong. You don't have appetite. Because if the liver is working on several issues and you are still eating, and the same food that you are eating should go to the same food you are eating should go to the liver to be detoxed, to be changed into water soluble. What will you have? Massive breakdown. So what happens is the brain shuts and says you are full. Let the liver finish what is it fast. You get? Lose appetite, nausea, feeling full quickly. You eat a little, you feel full quickly, because in your body there is something there is an interaction between your brain and some hormones like ghrelin and some hormones that are in your stomach. Sometimes mild abdominal swelling because of acidity. Signs that may occur when there is an advanced problem. Signs that may occur when there is an advanced problem is like yellow eyes. It's called jaundice because the liver cells are dying off and producing bilirubin. Swelling of the legs, abdominal swelling from fluid. Yeah. You know, sometimes you can be saying, hey, nowadays you eat well. You are having a belly. They say people that take alcohol, they have a belly. One doubt, Benjamin Doctor, sir. Yes, ask. Or what am I seeing? Priya ask one question. Yes, one thing you have to know is it was not the belly which is full of food. No, it is ascites. Fluid is retained between the peritoneal layer of your belly, and then it is very painful. When you press, you feel pain. You get something that is called peritonitis. Sometimes easy bruising. When you cut yourself a bit, you bleed a lot because the factors that are produced in your liver, for pharmacy or BSc nursing, which course is best in the future? Both are good, but if you really want to practice in the hospital in full capacity, TPKY love, do BSc nursing. That one you will fully practice in the hospital. If you want to practice. But when you want to do a research, to be a researcher and do some things according to drugs and you can do pharmacy. Here in Kenya, many people do pharmacy to open their own drug stores. You see? So, you know, clotting factors, most of them are produced from your kidney, liver. The clotting factor, Christmas factor, Eggman's factor. We will talk about them again. We have that. We talked about them. Factor 3, factor 4. You remember them? The common pathway, the extrinsic pathway. All those we will redo. So, confusion. Blessings to you, Benjamin the wise guy, and everyone in the chat. I'm here preparing for the big day, which will be starting in a few minutes, my birthday celebration. Welcome. Let's sing for Jamaican Uncle Aso. Happy birthday to you. Happy birthday, dear uncle. Happy birthday to you. Happy birthday. You blow the candles, men, and see more and more. May God bless you. Eh? To get to where you always want. 1 million subscribers on YouTube, a cruise ship to the on the Bahamas that is right in Jamaican uncle. Yeah, hey. Can you imagine, you go to the Bahamas and then you find a cruise ship, yeah, an elated, cute cruise ship that is written Jamaican uncle. That let's wait and see one day. God will bring a happy birthday, Jamaican uncle. You are one and the loveliest person on earth that has a good and kind heart. Look, because of you, I have all these friends. Share Travels, TPKY Love, all so grateful, and everyone that is here, you understand. Thank you so much for being a good dad and a good grandfather. Thank you so much. And there is a song you told me to sing for you. A song by Dan. I will. So let's get going. Each skin is maybe identifying a problem with your liver. Confusion or excessive sleeping. Confusion or excessive sleeping means encephalopathy. Encephalopathy means ammonia gas or any other gas that is disturbing the brain, and then you have confusion. Dark urine or usually pale urine. Those are the signs of fatty liver. But you have to confirm by doing liver function test and doing something that is called what? An ultrasound to check. Flow with Karina. Yeah, man. We are flowing with Karina. But now that the fatty liver thing has come out, Lydia, sometimes I go to Lydia's channel and then I keep quiet and watch. And Lydia, you know, me, I'm a silent listener. Silent listener. But please, let's sing for Jamaican uncle. Happy birthday, my guys. Happy birthday to you. Happy birthday to you. Happy birthday to you. I don't have a guitar. If I had a guitar, I could be playing happy birthday, dear uncle. Happy birthday. I can sing baritone, right? Or I can't sing soprano. Happy birthday. That is too high. What I can sing is happy birthday to you. Happy birthday to you. Happy birthday, dear uncle. Happy birthday, Dan. It's called Dan Dunkley. Big up you, big man, then. Big up you, big man. It's a blessing that God brought you to us, and you are helping us to grow every time, you know. A man upon Jamaica landed in the US and created an empire of positiveness, an empire of good positive vibes. That is Jamaican uncle upon Georgia, Atlanta. Uncle, much love and blessings on the special day. Happy birthday. Grace, there, Baji says, greetings flow with Karina. So, we have said fatty liver. That was a question from one of us who is called. So grateful asked the question, and now she knows, she understands. But you know, there are some things that we should also consider. Risk factors. Now that we've talked of symptoms, if you have any other Jamaican uncle, where is the party at what time so I could come? It will Share Travels, it will be live at the normal time at 9. It will be live at 9. So follow Jamaican Uncle and you'll see some good vibes. Let's talk about, it's Chwea out of Qatar. A man from Kenya vibing in Qatar like nothing else. How is Chwea? Chwea, bro, how is the going, man? How is the going? Hope you are doing good wherever you are. Chwea, hope you are doing good and blessings to us. And there is that song that it goes, my love is your blessing, blessing, darling. Everyone sing that to Jamaican Uncle today at his live. My love is your blessings, blessings, darling. We had to do a combination live with Jamaican Uncle, but because I knew it is his birthday, I didn't want it. I want Jamaican Uncle to enjoy. And you come to the birthday today with gifts. Let's give Jamaican Uncle them flowers today. Them flowers today on the birthday. So the risk factors of you having a fatty liver, is overweight or obesity. Excess abnormal fat can end up ruining your type 2 diabetes. Mohan Kumar from India. Mohan, how is the going? Where is Pantanatha, Mohan? Tell Pantha and Caribbean Pirates guy, Jack Sparrow, I'm here. Where are they? Insulin resistance promotes fat accumulation in the liver. So if you have insulin resistance, just know you are accumulating some things in the liver. High triglycerides, these are types of cholesterol. I hope you are learning something, everyone, about that. This is a question that was asked by So Grateful, our friend. High triglycerides. Excess blood fats can accumulate in the liver. Fats. Blood fats cause triglycerides. They are kind of cholesterols. So they can accumulate in the liver. High cholesterol, particularly when associated with metabolic syndromes. We have, by the way, I remember we have to do metabolic syndromes. You will be surprised the things you take for granted, how they are very important. I will do metabolic syndrome, but if you have a topic that you want us to start with next week, tell me so that I can put in consideration. The thing that is called metabolic syndrome, very important. Even diabetes is part of metabolic syndromes. Okay, now let's talk about excessive alcohol consumption. Who in the house takes alcohol? By the raise of hands, I know no one will raise a hand. Who in the house takes alcohol? Yes, doctor, thanks. I have learned a lot, and they say knowledge is useless. Learning is continuous process. Yes, even me, I'm still learning. I have an exam I have to do, but it's okay. I'll do it. I know I'll pass. Now, high cholesterol, excessive alcohol consumption can directly damage the liver cells and cause fat accumulation. The way I have explained previously, alcohol. Poor diet, especially diets high with foods that are unhealthy, foods that are processed, foods that have are artificial. You are taking things. Let me tell you one thing, my friends. Have you ever gone and tested something, a certain kind of thing that you bought in supermarket and cooked? It is tasting like chicken. You go and taste something else, it is tasting like meat. Something is tasting like pork. Or you go and buy a drink, you taste like mango juice. You go and taste another drink, you taste like apple juice. Go to those companies. Some of them you'll never find apples. Some of them you'll never find mangoes. What happens is, some people have gone through school and they have learned something that is called food engineering. So you take that drink and they have taken some substances that are like apple juice. They have mixed. The reaction comes out as an apple juice, yeah, or as a chicken, and then you feel that you are taking chicken. Eh? If you want chicken, go buy chicken, get it, eat it. Don't go for those processed packed meals. Yeah, someone will say I'm destroying the market. No, I'm not destroying the market. People, if you want it is a diverse world. If it is good for you and you feel nice, continue. But for the person who needs the other option which is better, continue. But most of the better options at times are expensive. So we pray God, we thank God, and we pray God. Excess refined carbohydrates such as sweets, white bread, and pastries excessively. Be careful on fatty liver. Lack of physical exercise. Metabolic syndrome, a combination of abnormal obesity, high blood pressure, high sugar levels, and abnormal cholesterol and triglycerides in your body. Man, rapid weight loss or malnutrition can cause these problems. You see, they can cause these problems. There are some things that you can have in your body that can bring so many bad problems. Rapid weight, sometimes you can have stress and then you just lose weight. Unexpected. Yeah? There are some things that we can talk about, like sleep apnea, polycystic for women, polycystic ovarian syndrome. I know you know that what is polycystic ovarian syndrome. Some inherited metabolic disorders. Age, family history, smoke, high blood pressure, particularly when it comes as part of metabolic syndrome. So how to reverse or improve fatty liver? I think that will be the last thing we do, and then we check on our next topic. But I've said, if you have a topic that you want us to discuss, don't tell me, text me, come to my inbox and tell me I want you to discuss this, and don't say it's me who said, if you can. But if you want me to discuss and give relevant examples by you, it's okay. I do whatever you direct me to do. I just hold the knowledge, but I do what you want me to do. Now, how to reverse this fatty liver? Lose excess weight gradually. Don't lose once. Exercise regularly. Reduce sugars. Reduce refined carbohydrates. Like white bread, pastries, cakes, refined cereals. Large portion of white rice is a problem. You understand me, man? Eat more vegetables. And we said vegetables are good. They contain fibers. And fibers help you in another way by clearing the colon excess sludge. You see, so if it clears the colon excess sludge, what happens? You are not at risk of getting colon cancer. That's why you need foods that are having fibers. Choose healthy fats like nuts, seeds, avocado, fish oil, and olive oil. People say olive oil smells bad. It is healthy. Eat adequate protein like fish, eggs, beans, lentils, legumes, and lean protein sources. Don't eat proteins that has got high cholesterol. No. Avoid or minimize alcohol. Hey, there are some people who love alcohol. You see here, I've said if you are taking alcohol, raise your hand. No one has raised his hand. No one has raised their hand, but behind the curtains, things are the other way around. Avoid and minimize alcohol, my friends. I've given an example of half a glass of wine, and some people have laughed at me. Control cholesterol and triglycerides. Treating abnormal fats and you can reduce cardiovascular effects. Treating abnormal fats can help your heart to pump well. Control blood pressure. If you are hypertensive, see a doctor to check the problem that is bringing the hypertension and treat it and stop getting drugs. But if it is genetic and it is secondary to something that cannot be eliminated, continue with the drugs. Never get tired of getting those drugs, because we need you here. I'm an addict of coffee person, not alcohol. Yes, so grateful loves coffee like Jamaican uncle. Even Jamaican uncle loves coffee. Don't use unnecessary supplements, and that is where I have a problem. This issue of saying I'm detoxing, I've gone to the supermarket, I've gone to a drugstore, I've gone to the shop, and I've bought something that is very good, some good supplement that is written on top, detox your body. Generalize, I don't know what. Once you see something on the counter or online written detox, my friend, run away. Run away. Because you are using unnecessary supplements. There is nothing like detoxing your body. Let me say that for free. Products and herbal remedies are not proven cures for fatty liver, and some can actually injure the liver itself. But because I have explained how the liver works, you understand? So when if one day I meet you, you have bought something written on top, detox, and you listen to me, I know there is a problem. Hey, review medications with a clinician or a physician. Don't stop prescribe medication yourself. If you are given medication with your doctor, don't stop prescribe medication. A clinician can determine whether any medication could be contributing to liver problems. And the most important thing when you have liver issues, get enough sleep. Aim for appropriate 7 to 9 hours and address persistent snoring, suspected apnea, because you need the oxygen. Snoring and apnea makes you not to get enough oxygen to the brain. You get me right, my friends? And it may injure the liver because it needs that oxygen to do its work, metabolism. My guys, what else do I need to say? What else? I can see my student lawyer from Uganda, Fiona, in the house. Fiona, how are you doing? Hope you are good. Thank you so much for showing ladies out here there is a girl responsible and disciplined like you and can live within the normal measures to be successful. I liked the live already. I was on a live. Oh, okay. You see, we need girls like Fiona to educate and continue inspiring girl child. Yes. Avoid crash diets. Thanks, Mr. Benjamin. I really appreciate it. If you have not seen what the lady lawyer is doing, please go and see the student lawyer Fiona from Uganda. You will like, very simple, organized, disciplined, with no drama. I like that. Rapid extreme diet isn't the preferred approach. Aim for steady, sustainable weight loss. When you want to lose weight, you start working hard, working extremely hard to the gym. That is inappropriate. You will have a burnout that will not be okay. Drink water instead of sugary beverage. This is a simple way to substantially reduce unnecessary sugar intake. Water. And thanks for everyone that has got a water bottle. And I know men don't like carrying around water bottle, but it is necessary. If you have a car, have a water bottle in your car. Have your liver assessed. In a year, at least do liver function once in a while. Do liver function at least once in a while. Check for liver fibrosis by doing an ultrasound at least once in a while. If mostly when you have issues in your family that are related to liver issues. Make the changes long term, not just acute. Because you had the speaking today, you try and you try and change your diet in 1, 2, 3 days. The other day, everything becomes a problem. You start becoming normal, taking drinks that are not appropriate, sugary. My friends, what else do you want daktari to say? In Kenya, we call doctors daktari. What else do you want daktari to say? So next week, what are we discussing, my people? My people, what are we discussing next week? Let me big up some people before I leave. Starting with Share Travels, and so grateful. Fiona in the house, and Jamaican uncle in the house, and it's Chua in the house again. He was here, and everyone that has come to support this channel with showing love. You know, I take things easy, and if you have learned me, I'm that person that takes things easy. I take, and if something is supposed to be done in the right way, that is the way I do it. And you know, people like me lose a lot of friends. Strict people lose a lot of friends. But it is nice when you are strict because you stay away from danger and unnecessary things. So, anyone with any last question, any question that I can handle before I step out? It is 7:18 p.m. Kenyan time. 7:18 p.m. Kenyan time. Or anyone with any question? We are grateful for the knowledge. Thank you. That's a compliment. That is the greatest compliment. That is a good compliment. Sometimes I give some time for some people type slowly with one hand, even on the phone. So I give some time for people to type slowly, and then if it is 3 minutes, someone has not typed anything or asked a question, we wrap up the day till tomorrow. But we are Yes. Any question? I'm waiting for questions. Anyone can ask anything. This is a channel where you ask anything medical, anything, and you know medical. Sometimes if you come here and you talk negativity, it is medical. I send you to a psychiatrist. I take every question. I'm the person who takes all the questions, every question. Every question without asking. So you come to ask, I reply. Yes. So how is everyone right now? In Kenya it is 7:20. I have 1 minute to go. 1 minute to go down and rest. But I have to watch through Jamaican uncle's birthday party. I have to watch Jamaican uncle's birthday party. So guys, remember we are going to watch birthdays party for Jamaican uncle. Don't miss. Uncle is a great person, so don't let Jamaican uncle down. Don't let Jamaican uncle down. Bye, Daktari. Blessed night to you and your family. Thank you so much. Bye bye, everyone. See you guys next time.